The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Hello and welcome to RUMC Vital Signs. I'm Alex Lutz. On our show, you will meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning, full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit RUMCSI.org. Kidney stones are a common and painful condition that millions of Americans experience every year. And while most kidney stones are passed harmlessly, for some kidney stones are a reoccurring problem requiring medical intervention and even surgery. Joining me is board-certified nephrologist Dr. Ayat. Dr. Ayat joined the medical team at Richmond University Medical Center in 2023. In addition to treating patients at the hospital, Dr. Ayat also sees patients in his office as a member of Richmond University Medical Center's Richmond Health Network. Welcome to the show.
Thank you for having me.
Thanks for coming on. I guess the best place to start is to give us a brief 101 on what the kidneys are, how they function.
Sure. The kidneys are two bean-shaped organs that's located down in the lower back. And basically the function of the kidney is to filter the blood and remove the waste product and balance the electrolyte and also fluid in a body. Each kidney contains around 1 million filtration unit called nephrons.
Okay.
And the nephrons...
There's 1 million in each kidney?
Yes.
So you have 2 million, wow,
yes.
That's a lot. Okay,
yes.
All right.
And each nephrons filter the blood and balance the electrolyte and also the fluid and dump the waste stuff and toxin into the urine.
Okay.
Also, kidney is responsible to regulate the blood pressure in the body. And also they producing a hormone to help the bone marrow make the blood cells. Mm-hmm. Also, another function of the kidney, a process of activation of vitamin D happen in the kidney. So the kidney is small, but they have multiple functions.
I was going to say, they're pretty a lot of functions there.
Yes.
So what exactly is a kidney stone and what are they made of?
Good question. The kidney stone is a mineral deposition of electrolyte and also the substance that the kidney dump in the urine. Mm-hmm. When we have a very high concentration of those minerals and substance, they can crystallize and they can precipitate inside the kidney. Mm-hmm. And when they slowly get bigger and bigger, it's going to be hard for the kidney to get rid of it. Mm-hmm. And they form a composition that we call it kidney stone. But they made a different type of substance and material like calcium phosphate, calcium oxalate, uric acid, steroid, or cysteine.
Mm-hmm. So it's a buildup of minerals that causes them to form, like are there conditions that cause them to form or they just can form on their own?
There is multiple conditions can be the risk factor for the kidney stone.
Okay.
One of the most common conditions that can cause the kidney stone to form is dehydrations. When we have a dehydrations, kidney try to absorb as much as water as possible to hold on to the water. So it comes in a cost of very concentrated urine. Mm-hmm. When the urine get very concentrated, the toxin and waste product that is in the urine, they easily can be precipitate and deposit as a crystal and form the kidney stone. We have some other medical conditions that can make the patients more prone to get kidney stone, like diabetes. Mm-hmm. Some urinary tract infection also can cause a form of kidney stones, like steroid kidney stones. We have some genetic predisposing factors to make the patient more prone to get kidney stones. Mm-hmm. That's why we have some families that they have more kidney stones in different family members.
Mm-hmm. And when you talk about dehydration, are we talking about prolonged dehydration, or you can actually get kidney stones if you're dehydrated like for a day? Like I'm thinking like a marathon runner.
Mm-hmm. No, I'm talking about prolonged
Oh,
dehydration.
dehydration.
Yes.
Okay. And how would a kidney stone present itself to someone who's never experienced it before? We all know about the pain, I guess, is the main one.
Yes. So usually the kidney stone present as sudden onset, sharp pain that comes in a wave form. The location of the pain is important when we take the history. Usually the location starts from lower back and sometimes lower abdomen, but it's radiated to the groin. The type of pain that patient had with kidney stones, they explain this pain as one of the intense pains that they ever experience. But very interesting feature of the kidney stone pain, usually the patients with the kidney stone pain, when you look at them, they can't find a comfortable position. They're constantly sitting and standing and try to find the positions that can decrease their pain. So it's different that type of pain that we have in intestine, for example, in appendicitis. Those type of patients with those type of pain, usually they stand still, they don't move, and they feel like more comfortable when they do that. But in the kidney stone pain, they're constantly moving and changing their positions to find the positions that decrease their pain. And sometimes the pain comes with the nausea and vomiting. And in some cases, they can see the blood in their urine. And some patients report difficulty in urinations and sometimes stop the stream of the urine.
Well, as someone who's had a kidney stone, I can say all of the above actually happens. And I want to thank my colleagues at Richmond University Medical Center for getting me through that. So if somebody is experiencing these symptoms and they come to the emergency room, as I did, how do you confirm that it's a kidney stone?
Okay. So first, the physical exam and also the history going to be helpful. The onset of pain, the location of the pain, and in a physical exam, sometimes we have a tenderness in the flank, on the back. As I mentioned before, sometimes patients report the blood in the urine, but it's not all the case. Usually we send the urine analysis, the urine test, and also the blood test. In urine analysis, we're looking for the crystals that can form as a kidney stones. Also, we're looking for blood cells. It shows us the hematuria or blood in the urine. In a blood test, we're looking for any metabolic abnormality or any type of metabolic disorder that can cause the kidney stone, like high phosphate or high calcium, or changing the in blood pH or acidity of the blood. Another type of test that we order for this type of patient is imaging. The gold standard imaging for the kidney stone is a CT scan. We call it CT urogram. In a CT scan, we can see the kidneys and also urethra and the bladder, and if any stone in that area, we can diagnose that. But in the office, if we have the patients with possible kidney stone, usually we send the patients for kidney ultrasound or just a regular X-ray. It could be helpful. But the CT scan with contrast would be the gold standard test for the kidney stone.
And once you diagnose a kidney stone, what are the treatment options?
Okay, so when we find out that where is the kidney stone and what is the size of the kidney stone, the treatment option would be different. So let me go through more details. If the kidney stone is less than 5 to 6 millimeter, there is a high chance that it's going to pass by itself. So we're going to hydrate the patients. We recommend the patients take medication like tamsulosin to relax the urethral muscle, and also exercise. And there is a high chance that the patients can pass this stone just by these. But the bigger kidney stones, more than 6, 7 millimeters, it's less chance that they pass. And sometimes if they start to pass, sometimes they cause obstruction. So we have a multiple urology procedure to remove the stones or break it down, like shock wave lithotripsy, that with the shock wave, they can break the stone to small pieces and the patients can pee it out. Some other procedures like retroscopic ureterogram, so we can do laser lithotripsy with the laser beam, break the stone, and patients can get rid of the stone through the urine. But some stones are very big and it cannot be removed by these procedures, and patients need surgery. So percutaneous lithotripsy and laparoscopic lithotripsy and removing the stones would be the way to go. Also, it's very important that we found out what is the composition of the kidney stone. Because different kidney stones, different materials that made kidney stones, they need a different type of diet or medications.
So once you know the kidney stones, you have a whole gamut of options available
Yes.
depending on what you have there. So, and then usually once you remove the kidney, the person back to normal, no issues, there's no residual issues with the kidneys or the ureter or anything?
That's usually when we remove the kidney stones, the kidney function go back to normal, unless the kidney was there for a long period of time and cause a condition that we call hydronephrosis. Means the swelling in the kidney stay for a long period of time, and it's cause more chronic damage to the kidney. Or if we have an infection in the kidney, sometimes the kidney stone is the consequence of infection in the kidney. And those patients need to be treated with long-term antibiotic.
And so if someone has had kidney, how would you prevent kidney stones? Or if someone was prone to kidney stones, how would you manage that condition?
Okay, so there is some general advice for all type of kidney stones. As I mentioned before, we have a very different type of kidney stones based on the composition of the kidney stone. So first, nephrologists try to figure it out what type of kidney stone patients develop. The most common type of kidney stones are calcium oxalate, but we have calcium phosphate, uric acid, steroid, cysteine kidney stone, or uric acid kidney stone. So first, we need to find out the patients prone to what type of kidney stone. There is two ways that we can figure it out. One is the patients collect the kidney stone. When the patient passes the stone, collect the stone and bring it to the office, and we can send it to the lab. And they can test it and give us the report. There is another way, and it's collecting the urine for 24 hours. So it's stone risk analysis. So based on the 24 hours urine test result, we can find out that the patient is prone to develop what type of kidney stones. So on that test, we measure and calculate the supersaturation of each of those substances. And for example, we find out that the calcium oxalate is more likely to precipitate, or calcium phosphate, or uric acid. And we're gonna basically design our treatments based on that specific. But we have some general advice for all type of kidney stones. And that's including the hydration, as everybody knows. But the amount of water is important. So how much water we're talking about? We need to produce at least 2 to 2.5 liters of the urine per day. So that much water we're talking about. So some patients working outside, maybe in a very hot area, so they need more water. But some others, maybe they don't lose that much water from the sweat. So we're talking about 2 to 2.5 liters of the urine per day. That much water is necessary to preventing kidney stone to form. Also, decrease the salt intake. It's very important. Decrease the animal protein. It's important. In some cases, if it's due to urinary tract infection, treat the infection is also important. And in some kidney stones that's made with calcium oxalate, decrease the food that contain oxalate, like spinach, nuts, chocolate, and coffee.
Well, you are definitely the expert on kidney stones. And we're fortunate to have you here on Staten Island. Thanks for coming on the show.
Thank you. I appreciate that. Yeah.
Well, I want to thank Dr. Ayat for coming on the show and sharing his expertise with us. Dr. Ayat is just one of the many specialists located across Staten Island as part of Richmond University Medical Center's Richmond Health Network. If you'd like to schedule an appointment with Dr. Ayat because of kidney stones or other issues with your kidneys, Dr. Ayat's office is located at 1800 Clove Road in the Emerson Hills section of Staten Island. When we come back, we'll share some of the latest developments at Richmond University Medical Center in our ongoing mission to better care for the communities of Staten Island.
Hi, I'm Steve Garvey, and I'm a prostate cancer survivor. But every year, 250,000 men are diagnosed with prostate cancer, and sadly, 35,000 or more die as it spreads to bones and vital organs. I'm saved because of early detection.
That's right, Steve. And besides being the #2 cancer killer of men, prostate cancer strikes black men at double the rate of the overall male population. We cannot allow this to continue.
Come on, guys. Stay in the game. For your family's sake, for your friends' sake, and for your sake.
Please, men, go to the doctor and have a discussion about prostate cancer. Early detection leads to the best outcomes. To learn more, go to fansforthecure.org. And thank you.
We're back on RUMC Vital Signs. So a lot's been going on at Richmond University Medical Center to help us better serve you and your families. Richmond University Medical Center recently achieved certification from both the American Stroke Association and the Joint Commission for its expertise and high-quality care performing thrombectomies for patients who have suffered a stroke. This certification officially designates RUMC as an advanced thrombectomy-capable stroke center. A thrombectomy is a minimally invasive procedure where a hair-thin catheter is inserted into a stroke victim to remove a blood clot from a vein or artery, restoring normal blood flow. RUMC first launched its thrombectomy program in 2019. RUMC also recently earned the Get With the Guidelines Stroke Gold Plus Quality Achievement Award from the American Heart Association and was also named to the association's Target Type 2 Diabetes Honor Roll for its special care of stroke patients who also have type 2 diabetes. RUMC earned the Gold Plus Award, the highest level possible, for its continuous commitment to ensuring stroke patients receive the most appropriate treatment according to nationally recognized guidelines. It's the 7th consecutive year that RUMC's stroke program has earned the Gold Plus distinction. RUMC also earned its spot on the American Heart Association's Target Type 2 Diabetes Honor Roll for continuously demonstrating specialized care for diabetic stroke patients. Patients diagnosed with type 2 diabetes may be at higher risk for complications after suffering a stroke. This year's Honor Roll Award marks the 4th consecutive year RUMC has earned that specialized award. Stroke is the #5 cause of death and a leading cause of disability in the United States. According to the American Heart Association, in 2022, over 165,000 deaths were due to stroke, and someone in the United States suffered a stroke every 3 minutes, 11 seconds. On the cancer front, RUMC has been awarded a grant to help combat the growing rate of colorectal cancer on Staten Island. RUMC was awarded $25,000 from the Harry S. Black and Alon Fuller Fund to expand educational outreach and the number of no-cost colonoscopies provided to underserved individuals. The Harry S. Black and Alon Fuller Fund was established in 1930 to support quality health care and human service programming for underserved communities. With the funds, RUMC will focus efforts on driving up colorectal cancer screening rates among low-income and uninsured community members and improve early detection of colon cancer. RUMC will utilize the funding to provide a limited number of no-cost colonoscopies to uninsured, underinsured, and low-income individuals. The hospital will also offer community-based educational sessions aimed at raising awareness about colorectal cancer prevention, the importance of early detection, and available screening resources. These education and outreach initiatives will be delivered in partnership with local community groups and faith-based organizations. Staten Island has the highest rate of colorectal cancer cases in all of New York City. Showing his continued support for Richmond University Medical Center, Staten Island Borough President Vito Fasella announced $1.52 million in capital funding he secured for the hospital to acquire state-of-the-art biplane imaging technology for its new Vascular Institute opening next year. The funding secured by the Borough President is included in New York City's fiscal year 2026 budget. Biplane imaging is one of the most advanced interventional technologies available. It uses two rotating cameras to take simultaneous images. As the cameras move side to side and front to back, they produce highly detailed images of blood vessels, soft tissue, and blood flow in real time. Biplane imaging is also used to map blood flow through vessels, which helps to find the precise location of disease, malformation, blockages, or aneurysms. Opening in 2026, RUMC's Joan and Alan Bernacow Heart and Vascular Institute will bring together advanced cardiology and neuroscience services under one unit. In addition to the biplane technology, the new institute will feature increased preoperative and holding bays to better accommodate patient volume, and the existing waiting and reception area will be refurbished and more centrally located within the suite for better flow and functionality. Turning to matters of the heart, in partnership with Move-In Health, RUMC is now offering at-home cardiac rehabilitation to qualifying patients. Through an innovative program, patients will be monitored virtually by RUMC cardiologists and a heart care team through devices provided to them, including a smartwatch, blood pressure monitoring cuff, and weight scale. The devices are included as part of the program at no extra cost to the patient and can be kept after completing the program. Designed as a 12-week program, both RUMC and Move-In Health will track each patient's activities and progress, making changes as needed based on the information collected. Patients will also meet weekly with a dedicated care manager to discuss healthy habit goals and track progress based on a set treatment plan developed by RUMC and by their RUMC cardiologist. They'll be encouraged to participate in virtual groups and individual exercise programs and enroll in educational classes that include topics such as nutrition and wellness. According to the Centers for Disease Control and Prevention, cardiac rehabilitation decreases the chances that a person will die in the 5 years following a heart attack or bypass surgery by about 35%. RUMC's cardiology department chief, Dr. Francesco Rotatori, will serve as medical director of the program and oversee all RUMC patients who enroll. For more information on the program, contact RUMC's cardiovascular department at 718-818-7425. Now shifting to community partnerships. Recently, Richmond University Medical Center recently signed partnership agreements with two well-known institutions on Staten Island, Project Hospitality and CUNY College of Staten Island. Project Hospitality offers care, advocacy, and support to individuals experiencing homelessness, hunger, and other hardships. The partnership with RUMC aims to enhance continuity of care for Project Hospitality clients following their discharge from RUMC and its affiliates, including the Richmond Health Network. The partnership will implement a clinical integration strategy to improve care coordination, ensuring better communication during hospital stays and discharge for Project Hospitality clients. Additionally, the agreement focuses on streamlining outpatient services by speeding up intake and appointment scheduling for both medical and behavioral health care. The other agreement with CUNY College of Staten Island sets forth a number of initiatives with the college, among them expanding training programs for CUNY students to complete practicums and clerkships at RUMC, creation of new postgraduate employment opportunities for CSI students, sports medicine coverage by RUMC for the school's athletic programs, and expansion of on-campus student health services. Now discussing prostate cancer. Prostate cancer is the most common cancer diagnosed in men in the United States after skin cancer, according to the American Cancer Society. Richmond University Medical Center recently hosted a prostate cancer awareness event at the Joan and Alan Bernacow Jewish Community Center of Staten Island in partnership with the nonprofit group Fans for the Cure. In attendance was former Major League Baseball pitcher and Staten Islander Jason Marquis. During his career, Marquis pitched for the Atlanta Braves, the St. Louis Cardinals, and the Colorado Rockies, and was named to the National League All-Star team in 2009. At the event of the JCC, attendees learned about the importance of early detection, available prostate cancer screenings, and spoke directly with urologists and medical professionals from RUMC about symptoms, risk factors, and treatments. Attendees also had an opportunity to meet Marquis, as well as receive a complimentary prostate cancer screening. This year alone, about 314,000 new cases will be diagnosed in the United States, and close to 36,000 lives will be lost due to prostate cancer. Fans for the Cure is a nonprofit organization dedicated to organizing medical, educational, and awareness programs focused on prostate cancer. Supporting young minds with an interest in healthcare, Richmond University Medical Center also recently introduced its medical science program for local high school students. Under the program, students are able to interact with and learn alongside hospital staff. Students rotate through nursing, radiology, respiratory therapy, laboratory services, and physical therapy, to name just a few of the departments. The program is open to high school seniors or juniors enrolled in any Staten Island high school, public or private. Each session runs for 6 weeks, with students coming to the hospital 1 day a week for 2 hours. Students must pass a physical from their primary care provider to be admitted into the program. To find out more or enroll in the program, call 718-818-2456. The COVID-19 pandemic touched millions of lives just over 5 years ago, which is hard to imagine. This past summer, Richmond University Medical Center unveiled a new permanent exhibit memorializing the hospital's response to the pandemic. The exhibit, located on the hospital's main floor, shines a light on RUMC's frontline workers who work tirelessly to provide continuous care to its patients, as well as on the generosity and support the hospital received from the community. A timeline of dates and events captures pivotal moments from the pandemic on a global, national, regional, and local level. Visitors are also able to view videos about staff and patients, see artwork sent during the pandemic from local schools, and read letters received from a grateful community. The exhibit also pays special tribute to 3 RUMC employees who passed away during the pandemic due to COVID-19. William Langley from the Dietary Services Department, Mary Ellen Porter, a longtime nurse and nurse administrator, and Margaret Venditti from the Medical Records Department. A hotbed for COVID-19 positivity in New York City, RUMC admitted its first COVID-19 positive patient on March 14, 2020. Less than 3 weeks later, over 200 patients were admitted to RUMC, many in need of advanced care. Some placed almost immediately on ventilators to assist their breathing. The pandemic exhibit was designed in partnership with the Staten Island Museum and David Henry Marketing and Media, with support provided in part by the Richmond University Medical Center Auxiliary. And finally, Richmond University Medical Center bid a fond farewell on October 17th to Dr. Dennis Bloomfield after over 50 years of service to the medical community and to all of Staten Island. Dr. Bloomfield began his career at RUMC in 1975 when it was still known as St. Vincent's Hospital, assuming the position of chair for the hospital's Department of Medicine. In 2002, he changed positions, becoming director of RUMC's Clinical Research Department, the role he'd fulfill until announcing his recent retirement. Dr. Bloomfield was a driving force behind many of the hospital's services, including the establishment of the hospital's cardiac catheterization lab and the cardiopulmonary rehabilitation center, to name just a few. The hospital honored Dr. Bloomfield for his many contributions and dedication to the hospital a few years ago by naming one of the school's medical conference rooms in his honor. Congratulations, Dr. Bloomfield, and enjoy your well-deserved retirement. Well, that's the latest, but before we sign off, a reminder that Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the Donate button, located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.